Hello everyone, my name is Samantha Davis, BSN RN. Today I am presenting my PowerPoint presentation for Jacksonville State University's MSN Population Health Program. My topic of conversation for this presentation, with everything going on in the world today and the state of our nation, is COVID-19. The presentation is titled COVID-19 Safety Guidelines and Practices. Let's start with my practicum objectives. And I'll read each one. Develop an oral presentation with PowerPoint utilizing Gagne's 9 events of instruction, including student learning outcomes and methods of assessment and evaluation. Incorporate icebreaker activities, case studies, current news, and events to attain the student's attention and interest. Identify barriers and challenges during the practicum learning experience. Utilize a learning management system to allow students to access needed materials outside of course meeting times. Recognize legal, ethical, and professional responsibilities as a nurse educator. Utilize a variety of assessment methods and evaluation of student learning. Employ teaching principles, educational theories, and evidence-based practice learned within nursing program in the classroom setting as a nurse educator. Use self-reflection as a strategy for professional growth and development as a nurse educator. Those are the practicum objectives. After the presentation, students will be able to demonstrate appropriate application of PPE, which is personal protective equipment, understand proper guidelines and practices to decrease contracting COVID-19, demonstrate appropriate application of masks and face coverings, understand what causes COVID-19 and symptoms that may appear. Now let's talk about the death toll. The death toll and infection for COVID-19 patients or individuals in the United States, and this is reported by the CDC, which is the Center for Disease Control and Prevention. And the number's probably different now because this is what it was when I was doing my research for this project. But at that time, it was at least 29 million cases, and those are the individuals that are infected. And it changes daily because of new infections and people that may die or have succumbed to the virus. So it's 29 million cases of infection added with another 40,336. And they're reporting that at least 525,000 deaths, those are the individuals that have succumbed to the virus, and then add another 682, which is an astronomical amount. Death toll and infection for COVID-19 in the United States. The CDC, the Center for Disease Control and Prevention, reports that as of January 1st, this year, 2021, the United States surpasses 20 million as deaths continue to mount. I have made an outline of everything that we'll be discussing in this presentation today, or this PowerPoint today. And we're going to first start. I'll read each one to you. Okay, what is COVID-19? We'll talk about that. What causes COVID-19 and how is it spread? Symptoms that may occur if infected. Proper guidelines and practices to prevent contracting COVID. Appropriate application of masks, face coverings, proper hand washing, and the use of hand sanitizer. And appropriate application of PPE, personal protective equipment. We'll start. What is coronavirus? Coronavirus disease is an infectious disease caused by a newly discovered coronavirus. I believe we first started hearing about the coronavirus, if I'm not mistaken, it was around the first of 2019, around the first part of the year, January, February of 2019. And I believe things started to really get kind of out of control, and just deaths started to mount around March of 2020. COVID-19 is caused by a coronavirus called SARS COV-2, older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes. Also, individuals that are immunocompromised who've received maybe some type of transplant, heart transplant, renal or kidney transplant, and are taking meds to prevent the body from rejecting the organ. Individuals that are battling AIDS, people that are infected with HIV, those are immunocompromised individuals. Those people are at a higher risk for developing more serious complications from COVID-19 illness if indeed they are, or if indeed they do become infected. How does COVID-19 spread? COVID-19 is thought to spread mainly through close contact, from person to person, including between people who are physically near each other within about 6 feet. People who are infected but do not show symptoms can also spread the virus to others. We're still learning about the virus and how it spreads, the severity of the illness and stuff that it causes. This is all new not only to us as Americans, but to the scientists, the physicians, and everybody that's studying this virus. Symptoms that may occur if infected. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illnesses. Symptoms may appear 2 to 14 days after you're exposed to the virus. People with these symptoms may have COVID-19. And if you have some of the symptoms but not all of the symptoms, it still doesn't matter. You need to everything should be about self-care in this pandemic, and you really need to go and have yourself assessed. You need to go see your primary care physician or some type of walk-in clinic or something, but you need to have yourself seen if you have a multitude of these symptoms. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell or loss of appetite, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Like I said, you may have some of these symptoms, but not all. But still have yourself seen, or go be seen by a medical professional. Proper guidelines and practices to prevent contraction continue. 3 factors to help make safer choices. The big 3 are location, proximity, and time. Location is everything. Open air spaces are safer than enclosed spaces. You know, it's not good to gather in like parties, social gatherings where everybody's kind of packed in to an area and very tightly packed into an area and very close to one another. Wide open spaces or open air spaces are much safer. Proximity, further away from others, is much safer than closer together, and where the CDC and other outlets are educating and saying at least 6 feet apart, and also the scientists and physicians, doctors are saying stay at least 6 feet apart and wear a mask. And shorter time periods with others are safer. If you have someone and you're visiting maybe a long care term facility, something like LTAC or a nursing home, then there are also a lot of guidelines that you have to, or even the hospital. There are cases in which someone may be dying and they'll let family come, but the guidelines are very strict, and you just have to do what you have to do if you're dealing with this in any case. Shopping for groceries. There are some things that we can do to help ourselves be safer, reduce the risk. When you get there, don't think that the grocery store is going to have hand sanitizer or mask to give you at the door. Bring your own. Go ahead and have your mask, your hand sanitizer with you when you come, so that you won't have to. There won't be any problems. Just have your own with you. And also, limit your time in the grocery store. If you kind of already know what you want to get in and out, or if you don't, go ahead and make a grocery list before you get there, which will help cut down on time. And then once you're inside the store, Keep your distance. Like, be courteous, but keep your distance from the next shopper. Just try to be quick in and out. Another thing that I kind of hear people saying is that, well, I have a medical appointment, or I have a doctor's appointment, or some type of self-care appointment, dentist or something, but I'm not going to go because of COVID. Do not put off necessary medical appointments due to COVID. Do not do that, because self-care is the big thing that's going to help battle or keep you from contracting the disease. Go ahead and have an appointment. Don't try to go as a walk-in. Have an appointment already set up. Wear your mask. Take your hand sanitizer and stuff with you. Once you're there and you see other patients kind of in there, just be courteous and keep your distance. Make sure you're at least 6 feet apart, but do not neglect your medical and your doctor's appointments. How to prepare in case someone gets sick in your household, or if there's someone in your home that is infected with the virus. The first thing is that person needs to be isolated. They need to have their own room. It needs to be well ventilated. And there needs to be maybe one person in the home that kind of does everything for that patient, so everybody's not going in and out of that person's room. And the person that you choose to kind of be the go-to person for the individual that's sick, that person needs to be fairly healthy and not riddled with a lot of chronic diseases. That needs to be a fairly healthy person that's kind of at low risk for contracting the virus. And then what to do if someone isn't in the household and they're sick. You need to also, like, use separate utensils. The plates, forks, knives, glasses, cups need to be washed, used, and then washed differently. They don't need to go in with all the other family members' stuff. If anything, you could just use maybe paper plates and cups and forks, and then dispose of those items after the person that is infected has used those. Also, bedding, sheets and bedding, and comforters, quilts, whatever's on the bed needs to be washed separately, and also the clothing needs to be washed separately from what the other family members, or from the other family members' items. That will also help cut down on contraction. Maintain at least 1 meter distance between yourself and others to reduce your risk of infection when they cough, sneeze, or speak. Maintain an even greater distance between yourself and others when indoors. The further away, the better. Make wearing a mask a normal part of being around other people. The appropriate use, storage, and cleaning or disposal of the mask are essential to making everything effective. How to wear a mask. Clean your hands before and after you put the mask on. Make sure it covers both your mouth, or all of your mouth, nose, and your chin. I've seen some people wearing it under their nose, but if you're wearing it under your nose, that is absolutely not effective. Because your nose is, wide open. It could go in your nose and, into your respiratory system. So the mouth, the nose, and the chin all need to be covered. When you take a mask off, store it in a clean plastic bag, and every day either wash it or dispose of it. If it's a fabric mask, you can wash it daily and reuse it. But if it is like a medical mask or a surgical mask, it needs to be disposed of daily. And do not use masks with valves. Hand washing and hand sanitizer use. Germs are everywhere. They can get into hands and items we touch during daily activities and make us sick. Cleaning hands at key times with soap and water or hand sanitizer that contains at least 60% alcohol is one of the most important steps you can take to avoid getting sick and spreading germs to those around you. I believe that hand washing is key. It's the best thing to do. Hand washing reduces the amounts of all types of germs, pesticides, metals, and stuff on hands. Knowing when to clean your hands and which method to use will give you the best chance of preventing sickness. Sometimes you can't use you're somewhere and you're out and you can't use soap and water. Then of course use hand sanitizer. It's proven to be effective, but there's some cases that you just need pure soap and water, like certain infections, C. difficile and stuff like that. Hand sanitizer is not effective. And this talks about our personal protective equipment. We use face shields, masks, face coverings. We use hair coverings. We use a plastic or some of the gowns are cloth, but we dispose of them after each use. We use a lot of different things in at work in the hospital setting. So to know how to actually put these items on, that is effective also, because you can, be wearing a mask and doing hand sanitizer, washing your hands, staying 6 feet apart, staying home, social distancing, all of that stuff. But a lot of us healthcare workers, you can still go in to take care of these patients with COVID-19 and still, even though you're doing everything perfect at home, not put this PPE on like it's supposed to be put on, and still contract COVID-19 and then bring that home to your family and then others that are also out and about and around you. First, in a hospital setting, we identify and we gather the proper PPE to don for like whatever the isolation is. We have droplet isolation, contact isolation. We have all kinds of isolation, airborne, and you need to know what you need to put on for each one of those different types of isolation, which at our facility it's listed, and we put a sign on each door if it's airborne, if it's droplet, if it's contact, and it'll underneath it shows on the sign that's on the door that we place for those isolation patients each piece of equipment that you will need, so that anybody coming from a different department, such as the laboratory or something, when they get there, they'll read on the door what all you need to have on to enter into this room. And my conclusion. Before the coronavirus disease in 2019, or before the coronavirus disease 2019 pandemic, about 6 in 10 adults in the United States had a chronic condition. 90% of the nation's healthcare expenditures were for people with chronic and mental health conditions, and chronic conditions accounted for 7 of the 10 leading causes of death in the United States. The COVID-19 pandemic has only further emphasized the importance of chronic disease prevention and care, especially because many chronic conditions increase the severity of the COVID-19 outcomes. Basically, that's saying self-care. You can't guarantee that you won't get COVID-19, but you can do your best to try to prevent yourself from getting it. Wear the mask, wash your hands, use hand sanitizer, stay home, social distance. When you're out in a grocery store, go in, get out, stay 6 feet apart. Just do the best, listen to the experts and do the best that you can. And that is my presentation. Thank you guys for listening.